Good morning, dear students. Welcome again at online classes. And as per timetable, the time has been allotted for the BA semester 5th population studies students. And today I will deal with the topic of health statistics. So health statistics is very much important nowadays, especially students when we are living and experiencing the era of COVID-19. And we all know that in the era of COVID-19, whole globe is concerned with the health statistics, and on the daily basis WHO used to reveal for us all the data related COVID-19, whether that is fatality, whether that is cases, whether that is recovery rate, whether that is healthcare facilities, or whether that is regarding the vaccine. So health statistics is an important topic to be learned. So let us start, students, and firstly know about the health of population. The health of population is described by measures of disease, functional status, and well-being that reflect both the level and distribution of health in the population. So this is the health of population, and due to this health of population, we are here to learn about the statistics of health. So what is health statistics? Health statistics refers to both quantitative data and the classification of such data in accordance with probability theory and the application to them of methods such as hypothesis testing. So we all use health statistics for this application of data for the hypothesis testing. And students, health statistics includes both empirical data and estimates related to health such as mortality, morbidity, risk factors, health service coverage, and health systems. So this is a huge database, and from that we used to do research on these areas. So students, the production and dissemination of health statistics is a core WHO activity mandated to WHO by its member states in its constitution. This is very much important, and nowadays you witnessing the role of WHO on the daily basis, especially in the era of COVID. So WHO programs compile and disseminate a broad range of statistics that play a key role in advocacy for health issues, monitoring and evaluation of health programs, and provision of technical assistance to countries. So this is the background of health statistics. And when we have to learn about the health statistics, we can say that health statistics are numbers about some aspects of health. This is a very simple meaning, okay? And statistics about births, deaths, marriages, and divorces are sometimes called vital statistics. So in the syllabus, you might learn about the term vital statistics. That is actually health statistics, okay? And researchers use statistics to use patterns of disease in group of people. That's why nowadays the data of COVID-19 is very much important for the researchers, and through that collection and compilation of data, actually we are moving to get vaccines in near future, okay? And this can help in figuring out who is at risk for certain diseases, finding ways to control diseases, and deciding which diseases should be studied. So students, this is about health statistics, and this is importance of health statistics, through which we manage to learn about the various types of diseases, and we managed to learn about the how to take care of ourselves. Okay, and there is certain terminologies also. Very speedily I will tell you about the incidence rate. This is a measure of disease frequency that describes how few new cases are developing. Morbidity is another term for illness or adverse outcome. Mortality is another term for death. Prevalence is to measure of disease frequency that describes the proportion of the population that has an existing disease at this single point in time. I have already told all you in the detail in your online classes, dear students, and that's why I will not repeat here. Okay, so the basic more statistics and risk. This is very much important in the era of COVID. Who are in the risk bearing stage, and this is the probability that an event will occur. The risk of disease is also called the cumulative incidence of disease and measures the proportion of population that acquires disease over a certain time interval. So risk is also a form of statistics that we used to collect for the sake of research. And then we used to do study design that involves the formulation of trials and experiments to conduct medical and epidemiological research. And at present we are doing for this COVID pandemic. Whole world is moving this for this medical trial to search for a new vaccine for the COVID-19. And this all as termed as vital statistics. Okay, so students, there are few terminologies for which this slide is presented, and that is called as Global Health Observatory, Global Health Estimates, and WHO Mortality Database. And this all three is the basic roots of health statistics. Just for example, what is Global Health Observatory? In short, we used to say WHO. WHO's portal providing access to data and analysis for monitoring the global health situation. This provides critical data and analysis for over 30 health themes, ranging from health systems to disease-specific themes, as well as direct access to the full database. So this is very much important for the health statistics, and WHO is an important stakeholder for this. Second is Global Health Estimates. The Global Health Estimates provide a comprehensive and comparable assessment of mortality and loss of health due to disease, injuries, and risk factors. Global, regional, and country estimates for full cause mortality and deaths and disability adjusted life years, which called as DALYs, by age, sex, cause, are available for download. This is also very much important for the health statistics. And third is WHO Mortality Database. This database of annual death registration data on causes of death by age and sex as reported for civil registration system of more than 100 member states. So this all are the important for the health statistics. This through which we used to collect data, read data, compile data, and analysis for the sake of health around the whole world. So students, for example, you can represent any health statistics with this pie diagram. This is the deaths and distribution of age and death in world in 2012. You can update this up to 2020. You can represent by this pie diagram. For example, in 2012, the total numbers of deaths was 55.9 million. And when you see the data, we can see that 55% of death was 70 years and over. And the most concerning is 30 to 69, 36%, 19.9 million. And again, in 0 to 4 years, 6.6 million, that is 12% mortality rate is there. So this all blue and violet and green word is a concern area, and through which we are here to make policy for developing and developed nations. So this is example how to present your health statistics. When you collect health statistics, you can present by this pie diagram. Okay, and with this bar diagram, I will not repeat because I have already told in online class. Through bar diagram, you can explain the statistics data. Through this type of data in which you can explain the changes in major cause of under 5 deaths globally, which regards with measles, HIV AIDS, diarrhea, pneumonia, malaria, other infections, intrapersonal related complications, injuries, birth complications and non-communicable disease. These all are the major disease you can collect from the global health statistics data, and then you can present like this. Okay, so this is the method of presentation which I am telling you, and already I have told you in the online classes. Dear students, this is the top 10 leading causes of death. And why this come? Because we collected this data and there are health statistics. And as your topic is health statistics, so you can get the top leading causes of death. For example, ischemic heart disease, stroke, lower respiratory infections, and these 3 is most important disease in the era of COVID-19. And you can see that in COVID-19, the most affected countries are Western countries, where the heart disease, stroke and lower respiratory system is a risk, very risk factor. So when you collect data of COVID-19, you can see that in developed countries, these 3 type of risk barriers are dying more. And next is COPD, diarrheal disease, HIV AIDS, tuberculosis, prematurity, trench, bronch and lung cancer, and diabetes and mellitus. So these are the 10 leading causes of death, and this you can collect from health statistics only. So you have to compare with India with America with these top leading causes of death. You can collect the data and then compare it and then analyze and then express your views. Okay. And again, this is the leading causes. Attributes mortality is high blood pressure, tobacco use, high blood glucose, physical inactivity, overweight, high cholesterol, unsafe sex, alcohol use, childhood underweight, indoor smoke from solid fuels. And dear students, already I have told you online classes that these all are the major causes of mortality in both developed as well as developing countries. In developed countries, high blood pressure, tobacco use and high blood glucose is the main cause, and in underdeveloped countries, child underweight and indoor smoke is the major cause. So you can see in our India, through this collection of data, Ujjwala scheme has been implemented in this country, because in Ujjwala scheme there are indoor smoke problem was there, and lots of rural women were dying due to this indoor smoke, and that's why this type of schemes used to come. And also Ayushman Bharat, through Ayushman Bharat, this child underweight and this type of problems can be addressed through this all schemes. So attributable mortality we can collect from the health statistics. Okay, and we can also present like this all the data by this type of diagram. You can see, you can express in high income group, middle income group and low income group, and you can express in one diagram high income, middle income and low income, all the types of diseases. High blood pressure, what is the case in high income group, low income group and middle income group. You all can express by collecting the data and expressing by this diagram. So this is how you have to learn how to collect the data and how to express data through this type of diagrams. Okay, and this is again one example of pie diagram. This is another one example. You can express with this chart, this bar diagram, and again you can compare top leading causes with this type of diagram, with bar diagram. And then, dear students, lastly I will say you the key findings of the statistics. When you collect these statistics, go for these statistics, there should be certain findings. For example, Through the global statistics, we found that high blood pressure is the leading risk factors for mortality, responsible for 13% of deaths globally. This is findings. Childhood underweight is the leading risk factors for burden of disease and is responsible for 2 million children dying per year, mainly in low-income countries. This is findings. Environmental risks such as unsafe water, sanitation and hygiene and indoor smoke from solid fuels cause around 2 million children deaths per year. This is also findings through statistics. Low fruit and vegetable intake, lack of exercise, alcohol and tobacco use, high body mass index, high cholesterol, high blood glucose and high blood pressure are risk factors responsible for more than half of the deaths due to heart disease, the leading cause of the death in the world. And this is also major findings. And then unsafe sex related to the Western countries, which leads to transmission of human papillomavirus, is responsible for virtual and deaths due to cervical cancer. Cervical cancer is responsible for 11% of the global unsafe sex deaths and is the leading cause of the cancer death in Africa. So this is very important key findings through the statistics. Tobacco is leading risk factor for mortality, responsible for 5.1 million deaths. Almost 1 in 8 deaths of adults over the age of 13 is due to smoking. Very important. That's why we avoid smoking and we promote not to smoke. And being overweight or suffering from obesity, in just example America, is the 5th leading risk of death. And it is responsible for 7% of deaths globally, 8% in high income countries and 7% in middle income countries. So these all are the findings through statistics. So dear students, the health statistics is a very important topic, and through that you can highlight about the findings of your study. Thank you.